Moms for Progress, doing another segment for my state abortion laws series. For this part, I want to talk about ultrasound requirements and also kind of like the teaching and the pamphlets that are clinics are required to give women before they get an abortion as required by state law. There are 14 states that have laws that have to do with ultrasound within the time frame of getting an abortion. Some of them just require that the clinic offer you information about getting an ultrasound for free, and some states have laws that require you to get an ultrasound before an abortion and require you to look at the image of the ultrasound before getting your abortion. So I want to talk about a few of those things, and there's really two reasons why states require that, and really reasons, more like desired outcomes. So the first would be increased cost and weight on the abortion clinics that provide abortions, that they have to have this printed material, that they have to have certain documents for the woman to sign, and they have to keep in compliance with that in order to keep up their abortion clinic status. The second desired outcome of requiring ultrasounds and requiring all these pamphlets to be given to a woman before she gets an abortion, I believe, is to make the woman feel like a piece of shit for getting an abortion. So more about that at the end of the video. But first, let's talk about the wording, and let's look at one of the laws that was passed this year with regards to ultrasound and teaching prior to an abortion. So we're going to look at Nebraska's law that they passed this year, their legislative bill 209. And what strikes me is basically they're redefining what informed consent is. So let's read the first part of it. No abortion shall be performed except with the voluntary and informed consent of the women upon whom the abortion is to be performed. Except in the case of an emergency situation, consent to an abortion is voluntary and informed only if. And we're going to go through quite a few things that are required if they want to call it a voluntary and an informed procedure. Now, having worked in a hospital and having taken care of lots of patients pre-procedure, I know what informed consent looks like, an informed consent form. I've seen plenty of them. I've helped patients sign them, go through them. I've been there when the doctor explains what informed consent is and when the patient gives their informed consent. And it's always has to do with the mortality rate of the procedure, the surgery they need, the risks, like you can get an infection here, an infection there, things like you can have sponges left in your body after the procedure, very medically based things that are informed consent. So as we go through these requirements of what informed consent for an abortion is, I hope you see how superfluous it is that that clinics report back to the state that all of these things have been provided to the woman who's about to get an abortion. So number one, the woman is told the following by the physician who is to perform the abortion. A, the particular medical risks associated with the particular abortion procedure, fair enough. B, the probable gestational age of the unborn child at the time of the abortion is to be performed. Likely the woman already knows that, but okay. C, the medical risks associated with carrying her child to term, so if she were to not have an abortion, fair enough. D, that she cannot be forced or required by anyone to have an abortion, fair enough. E, research indicates that mifepristone alone is not always effective in ending a pregnancy. That's the pill you can take in your first trimester that causes an abortion. Sometimes it's not always effective. And so this state wants you to know that if it's not effective, you can go to a clinic to have your baby saved if you change your mind. Kind of weird, but okay. Number two, the woman is informed by telephone or in person by the physician at least 24 hours before the abortion of the following. The name of the physician who will perform the abortion. That medical assistance benefits may be available for prenatal care, childbirth, and neonatal care, aka trying to convince her not to have an abortion. C, that the father is liable to assist in the support of her child, even in instances which the father is offered to pay for the abortion. Again, trying to convince her not to have an abortion. D, that she has the right to review the printed materials described in that section, which I believe is the pamphlet that showed you the diameter and size of the fetus as it goes along in your uterus. E, that she has the right to request a comprehensive list of healthcare providers, facilities, and clinics that offer to have ultrasounds free of charge. So for Nebraska, a clinic that offers abortions, they are required to have a list of a comprehensive list of all of the healthcare providers and facilities that offer ultrasounds free of charge. Now, part 3, if an ultrasound is used prior to the performance of an abortion, the physician who has performed the abortion or the representative shall perform an ultrasound of the woman's unborn child of a quality consistent with standard medical practice. B, simultaneously display the ultrasound images so that the woman may choose to view the ultrasound images or not view the ultrasound images. And C, if the woman requests information about the displayed ultrasound image, like she doesn't want to look at it, her questions must be answered, including the dimensions of the unborn child, the presence of cardiac activity, if present and viewable, and the presence of external members and internal organs, if present and viewable. So Nebraska has painstakingly, I'm sure, put into the wording of their law what the ultrasound tech can and should say to the woman should she have questions about her ultrasound. Now, as I said, this is voluntary up to this point. The only thing mandatory in Nebraska is that the clinic offers the woman a list of facilities that offer ultrasound procedures for free. Now, in other states, and we'll take a look at a graph in just a minute, it's actually required that a woman get an ultrasound prior to abortion. And even further than that, in some states, it's required that the woman look at the image of the ultrasound before she gets the abortion. So I found this information on a website. This is the Guttmacher Institute. They seem to have some pretty reliable information requirements for ultrasound. And they have a pretty cool graph, but it's kind of boring. So I actually went to another website, the Kaiser Family Foundation. They had the same information. They cite the article from the Guttmacher Institute, but they had a pretty cool interactive graph, you could say. So it lists all the states here. And then if the state has an ultrasound requirement, and there's 26 states that do have an ultrasound requirement, a law that in some way, shape, or form regulates clinics either offering ultrasound or providing it or requiring it. And if we click on it, then we can see which 26 states those are. The next column is the woman must receive information on accessing ultrasound services. So 14 states, yes, and when we click on that, we can see which 14 states. Next column, provisions of ultrasound required for abortion, and the provider must display and describe the image. In 3 states, that is required. And we can click on that and see which states, and then some other statistics there. So I want to share a video of a woman telling her experience where she was made feel like an awful person. And I want to, separate a couple different things. I've been talking about, elective abortions in this video and in this series. This woman has had a spontaneous miscarriage. And she presents to a Catholic hospital, and unfortunately in her area of the country, her only option is a Catholic hospital. And you can refer to my old videos about Catholic healthcare. 1 in 6 beds in America is a Catholic hospital. So Catholic hospitals have constraints of they're against abortion also when there's a spontaneous miscarriage. So this poor woman has had a spontaneous miscarriage and needs to have the fetus sucked out with a D&C, basically, or a D&E. Because she was at a Catholic hospital, they do not do those procedures for spontaneous miscarriages. You are forced to birth the baby naturally, and whether that's a risk to your health or the baby's further damage. And so she talks about her experience at this Catholic hospital and what it was like to have a spontaneous miscarriage and the subsequent emotional damage that they caused because of what they forced her to do out of guilt.
Then a couple of people had told me probably what was going to happen. I was like, go to the hospital, they would do a D&C. It's kind of an outpatient thing, be on my way. It's not what happened. I got there, got admitted. They started giving me drugs. Once they started giving me the drugs, there was nothing to discuss. It was just, this is the way it was. No options, no nothing. And I found out that it was drugs to put me in labor, which, by the way, it did not take me a couple hours to get out of there. I was in there for almost 2 days. So once they gave me the drugs for that, started feeling some pain, which they told me were contractions. But in the midst of all of this, then they approached me with a whole new set of things. Did I want pictures? Did I want to hold it? I'm sitting there. I can't say no, because then I look like a bad person. So I felt pressured into doing what they asked me to do. A little bit more time went on, and they were checking me. I was laying there like a normal pregnant woman, so I was dilated. They came in and gave me an epidural. And it was finally time where I could push through and deliver this. And as soon as it was over, they gave the fetus, but they kept referring it to as a baby. So it's still playing in my mind that it's still a baby, but I know it's not anymore. They put it on like a pillow type thing with a stuffed animal. It's probably about the size of my hand, and just left me with it. I don't know what to do. I can't say take this away, because then I look like a bad person, and what am I supposed to do with it? So then they asked me about blessing the baby. Jim was still Catholic at the time. His family was there. I didn't know any. Sure, I guess. Again, I felt like if I didn't, it was bad of me not to do it. So we decided that was fine. But they left me with the fetus in the room until the priest got there. So I had nothing to do but just stare at this and just continue to cry and go through everything that I couldn't believe what was happening. They finally got a hold of the priest. He came in and did his thing. And then they talked about doing burial, which, again, I wasn't sure what was going on. I couldn't understand why they were just doing this. Why don't they just do what they need to do and take everything to go? I think I had already been through enough, but they were just leaving it there and more things just to kind of guilt me into different things. They did take care of all that. They have a cemetery out. I think it's Fort Wright,
off Dixie Highway.
Yeah, where they do the buried miscarriages out there. So I think we went out there once, and that was all I could do. It just says baby help me. It was a horrific experience that lasted 2 days.
I didn't want to say no because then I look like a bad person. That completely resonates with me. And when I hear her story, which I'm so grateful she shared, she was courageous enough to share, I can see where societal expectations, religious expectations, patriarchal expectations make me bow down as a woman from what I want to do what other people expect me to do. If I were in the position to want an abortion and I were sitting in a clinic and I was offered a free ultrasound or was told I had to get an ultrasound and look at the image, if I was handed pamphlets that showed the baby, this fetus as it grows inside a uterus for 39 weeks, if I say no, it's going to cross my mind. If I say no, am I going to look like a bad person? And that's super unfortunate that society has caused us women to, again, bow down to other people's expectations. So what I hope I gained from this, her sharing her story and going through these videos for you to, and to share with you, and what I hope other women learn is to be courageous and to stand up for women's health, women's rights, emotional, the physical, that it's all connected. So all of these are attacks on women's rights, women's health, and women's well-being, both physical and emotional and mental, by making me feel like a horrible person for my decisions. And I think that's rampant in our society, and I think women need to band together and make sure we don't feel alone when we have to make these decisions.